I got this sickness since I was at Gambia Beach Hotel. I was a cook there, breakfast and fruit carving. So I work breakfast, after I go cook kitchen. When we have dinner function, I have to stay there and make fruit carving, decorate the function, all the buffet, I decorate it. So afterward, I was having pain to my legs, to my hands. So I will tell my boss, squeeze my leg, it's paining. After he will pain, after 3 days, they will take me to Ahmadian hospital. So when I drink one painkiller only, I can walk again for myself. The 3rd month, it was worst. I cannot walk. I go for X-ray, everything. Every month, I didn't see nothing. So I resigned. He said, Ada, these doctors are coming. I want you to meet them. I tell him, say, hey, Alaji Mustafa, wait till the next day. I go. He said, no, the 4th day, try and go there. So when I go, I meet doctor. Dr. Asid, he tell me, Ada, you will walk again if you come to India. I tell him, say, hey, I don't have money there because long time I don't work and we are poor family. And doctor said, no, talk to Elijah Mustafa. He will raise funding for you and you will have support. He said, Jim, give me number, I will send you. And you, all of the staff in Aakash Hospital, I'm thanking you, every one of you, because you make me not feel bad that I'm not at home. But when I come to India, when they operate me, I didn't know that they are operating me.
Hello everyone. So today we are sitting with Miss Ada. She is a middle-aged 56-year-old female who happened to be suffering from a very severe crippling type of arthritis, which is a rheumatoid arthritis, and it has so much so in last 20 plus years, it has affected almost all joints of the body, especially the weight-bearing joints, which include both the hips and the knees joint, and also it's affected all the small joints of the hands. So for last almost 2 decades, she has not been walking because of the crippling disease. And when she presented to us few months ago, we first of all evaluated, since she was totally bedridden for many years, we evaluated the nutritional status, the bone status, the blood work and the arthritis stage of activity, and all those. After thorough evaluation, we went ahead and did surgeries one by one. Both the knees were damaged and one of the hip was very severely damaged. We really had to go one by one to replace all the joints which were affected by severe form of arthritis. Unfortunately, during the first procedure, when we were doing one side hip and one side knee, because of the prolonged immobility, she suffered from an acute attack of pulmonary embolism. That is a kind of a life-threatening problem which can happen in patients who have been totally immobile for many months or years. And when they undergo a surgery, the risk of the fat from the bone going to the heart and the lung increases significantly. And because of that, on table at the end of the procedure, she suddenly had a drop in the blood pressure and she became pulseless. And with the concerted effort of the entire team, including our anesthesia team, the critical care team, we were able to save the patient right on the table. We were able to revive her, resuscitate her. I still clearly remember that it was almost 50 minutes of marathon resuscitative effort by the anesthesia team, which brought her back to life, and we were able to safeguard the immediate danger to life by all those resuscitative measures.
So, what do I tell you about Ada? I call her the miracle girl. She is God's very own special kid. So this young lady from Gambia came to us for multiple joint replacement surgeries. When I dig deep into her history, I realized that she was a very active chef back in her country, but gradually the disease of arthritis had crippled her and confined her to bed. After investigating her thoroughly, we took her up for her first joint replacement surgery. And as I was interacting with her during the surgical procedure, I suddenly realized that a major cardiovascular event had struck her. She was in pulseless electrical activity, or what I should tell you as a state of shock. And then started the intense efforts of resuscitation. 50 minutes, the entire team of anesthesiology supported by cardiology and intensive care started their resuscitation efforts on her. And we realized that a lot had to be done to get her back. But as God's will prevailed and Ada's spirit fought, she got back. She got back and fought it out. But that was not the end of the horrific journey. We resuscitated her, saved her, took her to the intensive care unit, and then started a long and ardent journey of recovery. Each day, she would give us mixed signals. Someday, we would feel she's getting better, but the very next moment, her vitals and hemodynamics would completely falter. We took her up for every intervention defined in medical research to save her and protect her. And all these efforts paid off when Ada actually stabilized. We one fine day realized that now Ada was out of danger and could be shifted to our high dependency unit, where care, empathy, and good nursing really did the trick for her. Once we established complete recovery from the first surgery, we took her up for a multiple series of surgery, which has now enabled Ada to be back on her feet again. As her anesthesiologist, she is a story I will always remember, a story which will always remain close to my heart, because it not just reinforces my faith into the power of healthcare and medicine, but it also reinforces the fact that what we do always needs the grace of God. And we're so glad that Aakash Healthcare could actually be that source or the hands that provided God's grace for Ada. Hope she stays blessed.
Thereafter, she was managed in the critical care, diligently for next few weeks, and thereafter she was able to, come back to all normal activities. The breathing pattern improved, the circulation improved, the heart and lungs became better, and then the journey started for the rehabilitation of the operated side. And thereafter, after a few weeks, then we started focusing on the other side, which was also suffering from crippling arthritis, that side. We did the knee replacement, and fortunately, after all these 3 procedures, 3 joints were replaced. And because of that, now with the full rehabilitation effort, the person who was totally immobile for more than 2 decades, now she's able to stand without any support, and she's able to walk significant number of steps every single day. She's able to carry out her daily activities with little support, but I'm sure with the kind of courage and determination she holds, and the will to walk and will to get independent, I think in the next few months she's going to recover completely, to an extent that she'll be an example for all those people who have suffered from one form or the other form of arthritis, and they have been crippled to bed for a long time. Yes, there is still hope if you hold your confidence, if you have a right team of doctors to take care and to do the proper diagnosis and then manage the problem to the best of their abilities. So I'm very thankful to Ada for trusting Aakash Healthcare, our team, for managing your crippling problem, and I'm happy to see you going back home in a much better form and more happier and a determined soul. I can with a lot of surety I can say that once you continue on this journey of rehabilitation in next few months, you'll be walking without any support and going back to your independent life within no time. So thank you so much for trusting us, and my message to you, your family, is that and the entire population of Gambia who because of one or the other reason they are not getting the good quality healthcare. So Aakash Healthcare is there to serve them with the best of our abilities and capabilities and clinical acumen, and I'm sure that our association as doctor and patient is definitely going to finish once you are fully rehabilitated.
I'm thanking you and thanking the ambassador, because he is the one who make me know that you are in Gambia. He is very hardworking and very kind person. When I told her that, tell him that I cannot go the first day, he said, no, Ada, go the first day. He gave me Ruhit number and Ajifatu and Buba. Through them, I can reach you. And what you have told me, all 100%, I see it, because you give me the courage that I will walk, I can walk again, because I never thought that I can walk again. You give me the courage, and I have faith that what you told me, it will happen, and it has happened. So I'm thanking you. You are always in my prayers. I wish you have all worldwide. You have every country, you have their hospital. Even in Gambia, you will have hospital there. Because when I go, a lot of people will be coming here for treatment. Because I never thought in my life that I will walk again.
Thank you. Thank you so much for the
You're welcome.
Thank you.